We're now going to look at the measurements of the fetal skull. We've already looked at the bones and the diameters of the pelvis, and now we have to look at the fetal skull and see how these measurements compare. And so we'll move on now to the first slide in this presentation. Here we have a side-on view of the fetal skull, and you will see there are different bones here. We've got the frontal bone, which is at the front by the brow. The other name for the brow is the sinciput. We've also got the parietal bones. There are two parietal bones, one on each side, and they join together a suture that we'll see better when we look at the top view of the skull. And then we've got the occipital bone at the back, at the base of the skull, and the area over the occipital bone is called the occiput. The area between the occiput and the brow is called the vertex. So the boundaries of the vertex are the two parietal eminences, which we'll also see in a future slide, and the anterior and posterior fontanelles, which are there. And you'll also see the temporal bone, which is low round about the ear level. And another bone there is the jawbone or the mandible, or another name for that used in maternity care is the mentum. I don't know why, but it is mentum. Another point of interest would be the bridge of the nose, which is another marker that is used as a measure on the fetal skull, and that is called the glabella. Glabella. So we've got, if we go from the chin, we've got the mentum there, and then come up to the bridge of the nose, we've got the glabella, then we've got the sinciput or brow, and then coming up to the top, we've got a triangular soft spot on the fetal skull, which is the anterior fontanelle. It's a membranous space. It is a diamond shape, and the name for that is the anterior fontanelle, or the medical term is the bregma. Then coming over the top, we've got the vertex, coming to the posterior fontanelle, which is a small triangular shaped membranous space, smaller than the anterior fontanelle, and that's called the posterior fontanelle, or lambda. That's Lambda, lambda. And then we have the occiput coming round the back to the base of the skull. And we'll look at more of these bones on the top side view on the next slide, and we'll also look at measurements in future slides. Now we're looking from the top of the baby's skull down onto the skull, and here you can see a different view of those bones. So we've got the two frontal bones at the front, the two parietal bones at the side, the occipital bone at the back. Here you can see there are two what were called parietal eminences. An eminence is the area where the bone has formed from. So in early fetal life, the bones are actually membrane, and they calcify from these eminences outwards. When the baby is born, the bones are well formed, but they're not completely joined together, and this allows the baby's head, the bones, to override a little. We call that moulding, when the bones can override and the head can shape a little bit and reduce the diameters to allow it to pass more easily through the pelvis and be born. And so the widest part of the baby's head is between these two parietal eminences, and that's the biparietal diameter. Now, other things that you need to note here that are of interest are these membranous spaces between the bones. So the spaces between the bones are called sutures, and the larger areas, the larger membranous spaces, are called fontanelles. So at the front we've got the frontal suture, and then going down the side between the frontal bones and the parietal bones is the coronal suture. That's where your crown would sit if you had such a thing. And then the suture that goes between from the frontal bones to the occipital bone, dividing the two parietal bones, is called the sagittal suture. Now, you might know that Sagittarians, I'm one of them, are the archers, and sagittal means arrow. So it has the diamond shaped anterior fontanelle at the front, and it has the triangular shaped posterior fontanelle at the back, and so it's thought to be sort of arrow shaped, so it's called the sagittal suture. And then the suture that goes between the occipital bones and the parietal bones at the back is called the lambdoidal suture, with the small posterior fontanelle there. And so now we'll go on to the next slide. Now we're going to look at the diameters. We looked at the widest diameter, the biparietal diameter. Now we're going to look at the other diameter that would be presenting when the baby is coming into the pelvis, and that would be the anteroposterior diameter. And when the baby's head is well tucked down, the chin's tucked down on the chest, as you hope it will be in that optimal positioning that we talk about, or occipital anterior. When it's well tucked down, the measurement is taken from under the occipital eminence, or the highest, most prominent part in the occiput, to the anterior fontanelle or bregma. So that measurement is the suboccipital bregmatic diameter, and it is also 9.5 centimetres. You'll remember that the biparietal diameter was 9.5 centimetres. Now you'll note that if the baby is presenting with this diameter, that it will be the vertex of the baby's head that will be presenting. And if you were to do a vaginal examination with a baby in this position, you would easily feel the posterior fontanelle, which would be reasonably central when the baby was coming down this way. The anterior fontanelle, you could probably just tip it, but you would have to go well around the baby's head to get to the anterior fontanelle. So you can see here the vertex is presenting. You can easily feel the posterior fontanelle, and the way that you know that is because there are three suture lines going off there. There's the sagittal suture at the front, the lambdoidal sutures at either side, and the posterior fontanelle in the middle. And so now we'll go on to the next slide. So now the baby's head is just a little bit less tucked down on the chest. The chin's up just a little bit, and the measurement now goes still from underneath the raised area on the occiput, underneath the occipital eminence, to the frontal bone, and that is a 10 centimetre measurement. So that's the suboccipital frontal diameter, and that is 10 centimetres. So the last one, the suboccipital bregmatic, was 9.5 centimetres, and the suboccipital frontal is 10 centimetres. And here you can see, if you did a vaginal examination now, you would find that the posterior fontanelle and the anterior fontanelle would be, you could feel both of them, and that, you know, neither would be central, both would be slightly off to one or either side. So you would know then, if you could feel that the baby's head is not so well tucked down, and that the diameter of the fetal head is slightly larger than it would be if it was well flexed. And so we'll go on now to the next slide. Now the baby's head is reasonably straight. It's more like a soldier standing to attention. And the measurement here is going from that raised area on the occiput to the frontal bone. So it's the occipital frontal, not the suboccipital, but the occipital frontal, and that is 11.5 centimetres. You can tell that's getting pretty close to some of the upper diameters of the female pelvis, and so this is a larger head, and could cause some difficulty, but it's still possible for the baby's head to get born with these diameters presenting. And then again, if we think about what we would be feeling vaginally, the anterior fontanelle would be much more prominent, and you'd be reaching round a little bit more to get to the posterior fontanelle. So you can tell this head is what we call deflexed, not well flexed at all. And so we're now going to go on to the next slide. Now here you can see that the baby's head is tilted back slightly, and when this is the case, it's the point of the chin or mentum that is one of the boundaries, and the top of the baby's head, or what they call the ventricle, is the other from the other area. And so the measurement goes, it's the mentoventricle measurement diameter, and that is 13.5 centimetres. Now this, if a baby was presenting this way, it would not be able to be born. So this would be an obstructed labour.